Good evening, good evening, good evening. Good to see everybody today. Hope that you've had a wonderful day today. It has been beautiful outside. Got out, went to work this morning, had a really good day at work. Hope you did too. Um, I am excited about tonight's show, as I always am, because we're going to give out some information to educate you on a disease or a disorder that I think that is very I don't want to say rampant, but it is kind of one of those things that happens in our community a lot. So we need to learn a little bit more about it. But first, let's go over again. Y'all know I told y'all last week I stopped watching the news. It gets to be overwhelming after so long, and then looking at every other uh, broadcast and it's about something happening bad, and I just kind of took a break from it. So this week I hadn't watched very many things. Of course, the big thing that we all know about that was in the news, of course, a couple of days ago was that Juneteenth is now a federal holiday. So I know that a lot of people celebrated, a lot of people had a lot of special things going on, and that is absolutely wonderful. It is something that we need to commemorate. It is a thing, a situation, or I don't even want to call it that, an event that happened in our history that we do need to make sure that we're educating our kids about and our younger folks. So it is a great thing that we now have that as a federal holiday. Um, Housekeeping things as usual. If this is your first time watching tonight, thank you so much for tuning in. I appreciate it. I know my hair probably looks a little bit different tonight. I decided to be straight for about a day or two. Trust me, the braids and the crinkles will be back in the next day or so because this keeping straight stuff is just too much work for me. And that means I got to actually physically comb my hair every day. I don't like doing that, y'all. So I'll be back to my braids and my crinkles in a day or so. Um, Happy birthday to anybody who had a birthday this week. Today is June 22nd. Let me make absolutely positively sure that that is right because, be absolutely honest with you, sometimes I forget what day it is because you're moving fast and you forget stuff. So it is June 22nd. So I do want to wish my oldest son, Charles, and his wife, Nicole, a happy anniversary. And my cousins just had an anniversary a couple of days ago. So happy anniversary to Yvonne and Mario as well. Happy anniversary to Charles and Carmel Carroll. Can't forget them down in Texas. Anybody who had a birthday this week or an anniversary you celebrate this week, happy birthday and happy anniversary to you. Again, go back to housekeeping. If this is your first time visiting, don't let it be your last. Go ahead and go over to the Ladies Lounge page and click like on our Facebook page. Also, go and check us out on YouTube and subscribe and make sure that you hit the bell so that you get the notifications when the new shows are out so that way you can keep up with them. There's a lot of old videos you can watch. Please go back and watch those and watch anything new that we post. Um, a lot of you tuned in this past Tuesday, Thursday, last week. Y'all, these days are running together for me. I told y'all 53 sometimes attacks and I forget stuff. But a lot of you tuned in the other night for May Rose Cafe Live. And for those of you that don't know what that is, it's my little version of my cooking show. And if you don't know what May Rose Cafe is, then you have to tune in and watch to find out because I'm not going to tell you. But I will be back uh, on Thursday night to give you something to. Oh no, I can't. I have somebody asking me, "Can I see him?" And I can't see him. No, I can't. I'm sorry. No, I can't. How about that? You got a guest that's trying to get signed on, and I thought I could see him, but I couldn't. But anyway, so tune in Thursday night for May Rose Cafe Live. I'll be showing you this is one of those recipes that my mama used to make for me when I would, in the middle of the wintertime, whine about wanting some barbecue. And we wasn't going outside to get on the grill, but she had a way of making me some that was really good. And it was something I loved. So I kind of feel like y'all will love it too. I'm not going to tell you what it is. You want to find out what it is? Come on back Thursday. I'll be on my personal page. So you'll view that one on Wonder Benton Low page on Facebook, and I'll be able to show you what it is that my mama used to make for me when I was a little girl and I wanted some barbecue. So, and she was being nice to me, and she didn't want to go outside in the snow and put food on the grill. So, come back Thursday, and we'll do that, and it's at 7 o'clock. So, make sure you got your notepad and pencil ready so you can take some notes for the recipe if you want to. Pull up your chair, get you something to drink, kick up your feet, and watch me cook. So try to do that every Thursday night at 7, just to kind of keep you interested, kind of give you some little things. If you want to try them at home, please do. If you do ever cook anything that I do on the show, then please make sure that you post pictures, tag me in them so I can go yay. And hopefully it tastes good and you enjoyed it. And just the experience of going in the kitchen and creating was something that got you up and going. So hope that you've been enjoying those. Let's see what else. So we covered join us on Facebook and hit the like and the share. Make sure that you like and share this show tonight. And what I'll go ahead and do now is kind of give you an overview of what we're going to talk about tonight. Like I said, this show is about an awareness thing on a health issue that is very prevalent in our community. And a lot of people are affected. A lot of people have family members who are dealing with or living with this particular condition. And tonight's show is, in honor of them and to educate the rest of us on some of the things they may be dealing with. So tonight we're going to be talking about sickle cell anemia. And I have a couple of great women here that are very knowledgeable in the area. This is the area they work in on a daily basis. They take care of patients, they educate families, they do the whole nine. So they have graciously agreed to come on tonight and kind of give us a little feedback on sickle cell and tell us give us a little bit of background. A lot of people have heard of it, a lot of people know about it, but maybe not enough people know. I always say you need to know more than enough about something to be dangerous. In other words, that way you learn something and you educate somebody else. So what I'm going to do right now is I'm going to go ahead and bring in my first guest. Hopefully the other lady will be able to get on in a minute. I know sometimes it's kind of hard for folks to get signed on. And here lately, internet has been jumping around, so it might be a little bit difficult. So if she's able to get on a little bit later, then we'll go ahead and pull her in also. But my first guest, let me get her in the room, add her to the there we go, is Ms. Stella Bowers. Let me put my eyeballs on so I can read y'all. Okay. Ms. Stella Bowers is a registered nurse at UAMS Adult Sickle Cell Program, and she's employed as the program's RN and case coordinator. She is responsible for coordinating care in clinic with a multidisciplinary team and coordinating patient care and education. In addition, she provides community outreach and education. She has participated on boards for sickle cell for over 15 years. Stella presently sits on the board of Sickle Cell Awareness, which is SCORE, and Stella is also a sickle cell trait carrier and birthed 2 children with sickle cell disease. So she can tell you firsthand about this. So I am very happy for you to be on tonight and so glad that you all had time in your schedule to fit me in so that you can kind of talk to us a little bit more about sickle cell. So I'm going to give you a couple of minutes just to kind of tell people more about yourself, because if you're dealing with the trait and you have 2 kids that may have it, then you're going to be able to give us a lot more insight. So just take a few minutes to tell us about you. Oh, and tell us about your shirt. I just noticed your shirt.
Oh, my shirt's Sickle Cell Diva, and on the back it says Advocate, because I'm an advocate for sickle cell disease, both at work and at home.
Okay.
I have 2 boys, one that passed actually. He has SC disease, and I have a 18-year-old. He'll be 19 in a couple of weeks. He has SS sickle cell. Me, I am a S trait carrier. With sickle cell disease, a trait carrier. Years ago, they said that we couldn't have signs and symptoms. My mom told me when I was little, and I remember when I was younger and running around playing outside and stuff, sometimes I used to come home and say, Mama, my leg hurt, but it's nothing wrong with my leg.
Mm-hmm.
To take me to the ER and everything, and they could find nothing wrong with me. But
Mm-hmm.
then, because I'm 55, back then in the 70s and the 80s, they said you couldn't have signs and symptoms with the trait. Today, they do know that trait carriers sometimes do have signs and symptoms of the disease.
Mm-hmm.
My boys, like I said, they are, one has SC and one has SS. There are
Mm-hmm.
types of sickle cell disease. And we at home, we actually manage, with both of my boys, I manage the disease at home most of the time.
Okay.
Which was a blessing. And I know that was a blessing because I've worked with sickle cell kids for the last 15 years or more because I did sickle cell camp also with another organization. With my boys, I was actually blessed. I could probably count the times that we had serious crisis and were in the hospital. And my youngest is 19. You see what I'm saying? I can still go back and tell you those times. All parents cannot do that
Mm-hmm.
because, each individual is different. Um, my kids, we tried to eat right. If we played outside, we tried to drink a lot of water. We got enough rest. With my youngest, he was a little bit of a challenge because he had SS and he loved the water.
Mm-hmm.
So once you get in the water and you get out of the water, if you don't dry off real fast and get warmed up, you will shiver. And for him, that created a bunch of issues because him shivering made his red blood cells kind of shake up and stick together. And he would have many crises after swimming. And we had to realize, hey, when you get out, you're going to have to dry off immediately. You're going to have to either stay in the water or get out the water because it creates problems. Now, my oldest, he had SC disease. When he would get hurt on the playground and stuff like that, he would have crises. They would be localized because they would be in the spot that he hurt himself. And he, with his SC disease, he also had eye issues, actually coming with SC disease.
Now, give the distinction between, you said one son has SS and one has SC. Kind
Hmm.
of tell us what the SS is and what SC is.
Well, let's go back and just kind of tell them what sickle cell disease is.
There you go.
Sickle cell disease is actually a red blood cell disorder. It is the red blood cell is missing a component. I'm going to go back a little bit farther and tell you how sickle cell disease actually came about. Sickle cell disease originated in the northern hemisphere of the world in Africa, South Africa, India. And when malaria was running rapid back in the 1800s, actually the body actually created a mechanism and changed the red blood cell because malaria attacked the red blood cells. So what the body did to protect itself from the malaria, it changed the shape and the mechanism of the red blood cell to fool malaria, basically.
Okay.
So in doing that, the body created another disease, which is called sickle cell disease. That there are several different types, and with each type, there's something different missing. The biggest thing is with the red blood cell is not whole. Red blood cells are round, but with sickle cells, some of them are sickle and some of them are C-shaped. That is the where you get the SC and the SS.
Okay.
SS is the worst type of sickle cell disease. So the difference is what is missing in the red blood cell. That is the difference in the different types of sickle cell disease. Now, when I first started my job, I knew there were 4 types of sickle cell disease.
Mm-hmm.
Actually, there's about 17. We see a
Wait.
total.
You said how many was when you started?
I thought it was I when I first started the
Uh-huh.
job. I knew of 4 different types of disease because I had camp and everything. So we dealt with children, and my 2 children had SS and SC, and in camp we had children that had S beta thalassemia and zero beta thalassemia. So I knew of 4 types. But when I started working at UMS with sickle cell disease, and I put it in the database to look up the disease to do a diagnosis code, about 17 or more came up. I was like, ah. But in the it is actually that many. We see a total of 7 different types at our clinic. We
Mm-hmm.
see the SS, SC, S beta thalassemia, S beta zero thalassemia, O Arab, and A beta thalassemia.
Okay. Now that's a lot to ask, but what's the difference in those different kinds?
Okay, I
Or
cannot.
just do just one of them. I said just do one of them because that's a lot for you to explain. Just one of them is fine.
And what it is with each different type of disease. I wish Colin was here because she could do this a whole lot better than me.
No, let me bring her on then, because she just found. I think she's ready to go. So let me bring her in real quick.
Okay.
Uh,
And what is a that's missing in the red blood cell? That's
Hello.
Hello. All right. Can you hear us? Okay.
Yeah, I just wanted to make sure you can hear us.
Yes, ma'am. Let me introduce you real quick. Let me reach a little bio, and then we're gonna get you because I'm asking questions about the different types right now.
Okay.
And Ms. Stella said you could answer that better. So let me give folks the background on you. This is Colin Montgomery, and she has served as the Advanced Practice Registered Nurse, APRN Coordinator for the UAMS Sickle Cell Program for nearly 5 years. As the APRN Coordinator, Colin collaborates with multidisciplinary care team to deliver and facilitate holistic care through assessment, treatment plan development, maintenance, and follow-up. In addition to her clinical duties, Colin manages program oversight, education, and outreach. Colin presently sits on the board of Sickle Cell of Arkansas SCORE. So thank you so much, Ms. Colin, for being able to sign on this evening. We appreciate you.
Thank you for having me.
Yes, ma'am.
So, as Stella was saying, there are 4 major types of sickle cell disease. There are multiple types, but we have the 4 large categories. And we like to divide those into 2 sections: the milder form of the disease, and then the more severe type of the disease. So, your patients that have SS and S beta thalassemia plus are considered to have the more severe type of disease, shortened life expectancy, and different types of complications. Your SC and beta thalassemia plus patients have the milder form of the disease and they have a longer life expectancy. Basically, we categorize them by the complications and the life that the patient typically, how long the patient lives. Now, can the complications carry over into all types? Absolutely. There are just some complications that are more common in the milder form and some complications that are more common in the more severe form of sickle cell disease.
What are some of those common complications?
So for your SC patients, they have a lot of eye complications, like Stella was saying. So they can have bleeding in the eye. They can have problems with their retina, where it can fully detach, partially detach, leading to partial blindness, complete blindness. They have more kidney issues, and you see them with more bone complications. So those sickled cells, shaped like a crescent moon or like an old school sickle. Your red blood cells are responsible for taking oxygen to various parts of the body. That sickled cell does not have the oxygen carrying capacity. So everything in your body requires oxygen to live. When it doesn't get enough oxygen, it gets damaged and it dies. And that is how sickle cell affects the body.
Okay. Now, growing up, I had a friend. We were in Forest together, and I think she passed away as a teenager. I think she lived to be about 17. And I can remember her always making sure that she didn't bump herself. Like, we were rough kids and we played around a lot. So we had to make sure that we didn't like bump into her or push her down. And she made sure that she was very careful about moving around so that she didn't fall. Because she'd had a couple incidents where she'd fallen and gotten really sick behind it. Well, by me being so young, I didn't really understand what was going on until, the last crisis she had and she passed away. But I just remember her saying she was tired a lot. So is being tired a lot one of the symptoms?
That is common because they run lower blood counts. I will say, up until about 20 years ago, sickle cell disease was considered a disease of childhood, just meaning that sickle cell patients wouldn't make it into adulthood.
Wow.
The care is very different now, and even the things that we tell parents is very different. And I collaborate with children, but I don't take care of children. But it's my understanding that previously the thought was to keep the child in a bubble.
Wow.
And that's because they had a shortened life expectancy. So don't let them engage in activities. It's very different now. Stella can tell you about her boys and how you kind of treat them as if they're normal until they're not normal.
Okay.
And her son, especially her youngest son, has played sports that 30 years ago they would have discouraged, but he's done fine, right? And he's learned how to navigate life with his disease and kind of do the things that he wants to do.
is interesting. I know she was saying about the 17 different kinds, and I'm going, well, I'm glad we're having this show because I'll be honest with you, of course, I'm probably like most people. We just know that there is sickle cell anemia. We would have never
Right.
known that there were all those different categories and that each one of them had its own set of symptoms or different things going on. So I'm so glad that y'all are educating us on that because we don't know that. That's not a common thing. Um, talk a little bit more about Stella. Talk a little bit more about things that you do to manage yours. Now, as a trade carrier, is there anything in particular that you have to do?
With me as a trait carrier,
Mm-hmm.
I just make sure I drink when I exercise and stuff. I make sure I drink enough water. Um, when I'm outside in the heat, make sure I drink enough water. But with my boys, I made sure they did the same thing. This is what I always told my children and the children in camp. You
Mm-hmm.
can do anything in life that you want to do. Play football, play basketball. It's just that you have to make moderations to be
Mm-hmm.
do it. Where some kids can run outside all day and play and never go in the house to cool off and drink minimal water. With sickle cell children, you can't do that. You have to eat right, you have to drink your fluids, and you have to get enough rest to stay healthy and live your best life.
Mm-hmm. Okay.
I think, sorry to interrupt.
Good.
Something very important about trait is, like Stella said, most often they don't have complications, but it's absolutely possible. I mean, one of my coworkers went skiing, and because of the altitude, she behaved like a sickle cell patient, like wasn't getting enough oxygen, had
Mm-hmm.
to, get oxygen, stop what she was doing, hydrate, and all those things. I think the biggest thing that we miss, especially because sickle cell disease is an inherited disorder, so it's not like it enters a family and they're like, oh, I've never heard of it. I think what happens though is they're notified at birth that the child has sickle cell trait. And I kind of think the letter kind of reads, Glory, hallelujah, you don't have sickle cell. But sickle cell
Mm-hmm.
trait also means something. And about with every birth, two people that have trait, there's a 25% chance that the child will be born with sickle cell disease. And
Mm-hmm.
that's very important to pass off to our young people as they start to have children and procreate. And most of them will tell me now, I heard I had sickle cell trait, but I didn't really know what that meant. And I think
Mm-hmm.
that's the biggest thing that can affect everyone is if you have children with someone that also has disease or trait, there's a 25% chance that you'll have a child with sickle cell disease. And that's with every pregnancy. That chance doesn't change.
Okay.
So that's something to
So,
pass on.
okay. Now, when I was doing a little bit of reading for the show, like I said, I told you I knew about just sickle cell, about kind of what it was. But just doing a little reading, I was looking at who all it affects. Talk a little bit more about that. Who exactly is affected by this disease the most, or where is it most prevalent?
So the CDC estimates 100,000 people in the U.S. are affected by sickle cell disease. Um, it is very common in people of African descent, as Stella said, because it was a malaria protector, right? So malaria was killing lots of Africans, but if you had sickle cell disease, you were more likely to live. So if you have a lot of people that are living with sickle cell disease and sickle cell trait, you would expect they're going to produce more people with sickle cell disease. It does not affect only African Americans. Just so happens we have a lot of African Americans in our country. So it affects people of Indian descent, Spanish
Mm-hmm.
speaking areas, the Caribbean, Saudi Arabia. Other ethnicities are affected. It's just the bulk of the United States, we have a large African American population, and that's why it's so prevalent among African Americans.
Okay. What about among Arkansans? I mean, I look at a lot of different things, and of course, we have one of the highest obesity rates. We have one of the highest stroke rates. We have some growing numbers in cancer. Where does sickle cell rank amongst all those other uh, disorders?
So it is considered an orphan disease, and that's because it affects only a very small amount of people. It is estimated, I think, I may be wrong, I think we have about 800 people, adults with sickle
Mm-hmm.
cell, we estimate in Arkansas, and I think there may be more, about the same or more children. So it doesn't affect as many people as you would think of like diabetes and hypertension. It's not like that. It's a very,
Mm-hmm.
very small amount. Even though 100,000 seems very large, but in the grand scheme of disorders,
Mm-hmm.
less African Americans are affected by sickle cell disease than like hypertension or diabetes or cardiovascular disease.
That's interesting because you would think, well, I don't know why I would guess it would probably be a little higher, but I'm surprised that it is that low because I would have thought it would have been more. Interesting. So, treatment wise, what are some of the things? So you talked, Stella talked about a little bit about when your son have a crisis. Talk a little bit about what happens during a crisis. Because I have a Facebook friend, matter of fact, she's been on the show before, and I know that she had one. I think it's been probably a year ago, and I know she was in the hospital a really long time, but I've never known, what exactly happens when a person is in a sickle cell crisis.
When a person is in a sickle, it's they depends, but if they're in a sometimes they and sometimes please.
Hold on just a second. Somebody's, I can't tell who that is. Let me mute you just a second. Now, go ahead, Stella.
Okay, with
Yeah.
my we mostly had centralized pain. Like they would either have elbow pain or knee pain or leg pain. My youngest had what we call hand feet syndrome. When he was a young kid, his hands and his feet swell all the time.
Okay.
With that pain, you use heat, you do ibuprofen. Those are the things that you start with. Heat
Mm-hmm.
and ibuprofen. Most sickle cell patients have something stronger than ibuprofen if that ibuprofen is not working, and they usually have some type of opiate at home that works. With my boys, we would do our ibuprofen, Tylenol, pain meds for 24 to 48 hours. If I could keep them controlled for 24 to 48 hours, a lot of the time we could usually get through that crisis at home.
Mm-hmm.
But sometimes we would be 6 hours into a crisis and nothing is controlling their pain.
Okay.
And we have to go to the ER. But we recommend with our patients that they take pain medicine around the clock every 6 hours, every 4 to 6 hours for at least 24 hours
Mm-hmm.
before to the ER if possible. Because if you take 2 doses of medicine, 3 doses of medicine, and it never changes the pain, you know that home remedies aren't going to work. You
Yeah.
need to ER. So we do recommend, and we always have attempted to control our pain at home because pain is the most prominent symptom of sickle cell disease. Now, as far as maintenance and trying to help control sickle cell, there are several things that actually exist now, and I'll let Colin talk about those.
Okay. And now unmute her.
And mute me.
All right, got
I'm
you. Go
so
ahead.
sorry that I was unmuted. First, there's two types of crisis. There's considered a complicated and uncomplicated crisis. I
Mm-hmm.
would assume, I mean, even lay and medical people hear crisis and think the terms are synonymous. Uncomplicated crisis is just pain only. They're just having pain. A complicated crisis means they have some infection and pain. So absolutely at home, my patients have home regimes on what works best. A lot of them that looks like kind of over the counter medicine, then they move to their opioids. But there are some times that they have pain that is not characteristic. And when
Mm-hmm.
they have symptoms that need evaluation, they seek care. So like cough, chest pain, fever, those things we worry may be a little more than pain. And sickle cell pain in and of itself, if it's not related to an infection, is not life threatening. But when you have it with an infection, it can be life threatening. So we teach them early on how to know the difference and when to seek care and management. Other than opioids and like hot showers and things that they do at home. We have medicines that decrease pain, and decrease the likelihood of pain. So we have hydroxyurea being the oldest drug that we use to manage sickle cell disease. And the best way I can describe that is it increases what's called the fetal hemoglobin, which is your good hemoglobin.
Okay.
Babies don't have, babies will have a crisis, their earliest crisis around 9 months. And the reason they don't have one until then is because they have fetal hemoglobin. The more good or fetal hemoglobin you have, the less bad hemoglobin or sickled hemoglobin your body makes. So hydroxyurea kind of turns you back into a baby, essentially, to decrease the days with pain. Now, does it take all the pain away? Absolutely not. But it can shorten the time they stay in the hospital. If they take it every day, it can also shorten how many pain episodes they have in a year. There's another medicine that kind of just hit the market. It's called crizanlizumab. I can't remember its fancy name off the top of my head because I always call it crizanlizumab. Stella's gonna tell me.
Uh-oh.
Oh, she.
Stella fell out of there somewhere. There she is.
I'm back.
Okay. And it shortens hospitalizations and also shortens pain crisis by a day, which really doesn't seem like a lot on the surface. But if you've been hurting for 2 days, getting rid of that third day really is a big deal. And that's an IV infusion, and that's something that is proactive. So hydroxyurea and crizanlizumab are both proactive. Like I said, we can't do anything to absolutely guarantee that you won't have pain as a sickle cell patient. And then when we're reactive, we use our opioids or our pain medicines.
What actually is causing pain? Is it because the blood cells are sickle shaped and they clot, or what actually is causing the pain?
So it's multifactorial. A part of that sickled cell that makes it different from a sickled cell is a red blood cell. What makes it different is it is rigid and it's very sticky. Okay. A regular red blood cell looks like a donut, and it can get really large when it needs to, but if it needs to travel through a really tiny vessel, it'll get small and it can go through the vessel. The sickled cell can't do that, so it just gets stuck. Okay. So it sticks to the lining inside of your vessels, which causes inflammation. Okay. And then when you're not getting enough oxygen again, things are dying, which also causes pain.
Now, oh my God, my mind went blank. We just said it a few minutes ago. The infection part. Now, is that, the sickle cell is not what causes the infection. Maybe they have an infection because of something else, and that's what makes it worse. Or is it that when the blood cells get clotted or get stuck in a different place, does that cause infection, or where does the infection part come in?
They have some infections that are just more common among them. One being like your pneumococcal infections, and that's because their spleen. Your spleen protects you from certain types of bacteria. A lot of times in sickle cell patients, early in life, either their spleen is removed because it's had a complication, or as I say, they're functionally asplenic, which means that spleen is just in there and it's not doing anything. Okay. So it can't protect you. There's another thing called acute chest syndrome, which is common in sickle cell patients, which is, for all practical purposes, just like a really severe pneumonia. And then there are things that are common to them, but then you just have to treat them like regular patients, right? They can get any infection that anybody else can have. Okay. It's just, I think, sometimes harder with sickle cell patients because this is a person that is used to dealing with pain, and that they oftentimes don't get the best care when they go to the ER. So they're just more prone to stay at home and try to manage it at home. And sometimes that's not the safest option.
It just sounds like that would probably scare me so bad I'd want to go to.
By the time you're an adult, they have become very familiar with the healthcare system. So my patients stay at home for a very long time before they seek care.
But you did. Go ahead.
ER.
Go ahead, Stella.
I said some of that is due to the treatment that they receive in the ER.
Mm-hmm.
With going to the ER, our patients experience, how do I want to say it? They're sometimes looked at as drug seeking because we teach our patients to know what works.
Mm-hmm.
And when you go into the ER and you say, I need this, this, and this,
Mm-hmm.
of course, the first thing they think is you're drug seeking. But we teach them to know what works for them. That way, you can come out of crisis faster and you can go home faster. And if
Mm-hmm.
healthcare providers would actually be more susceptible to listening to the patient, they could probably get the patients home faster.
Mm-hmm. That makes perfect sense that you are teaching, but I can see that. Yeah. I mean, having been in the emergency room for something not even, that to me that's serious, and people still acting like, well, you came to get pain medicine. No, I came for you to relieve my pain, but if you can do it without medicine, I'm totally happy and good with that. But yeah, I can see how folks would misconstrue that. Because if you're walking in and you're able to tell me the name of what she just said that I cannot even repeat right now, then yeah, people will assume certain things. But to me, if you're a healthcare provider, your assumption is not necessary. Treat the patient, give them what they need so that they can feel better, they can go home. Everybody's happy. So that's
Yeah.
crazy.
And with going to the ER, you have and pulling the patients back, they pull the patient back in severity. And
Mm-hmm.
sickle cell anemia is not considered severe in the lineup of ER. You know what I mean? It's not ranked in ER. With children, with my boys, going to the ER, the only thing that went in before them was a baby with a temp or somebody that was bleeding, somebody with breathing problems, or somebody complaining of chest pain. They
Mm-hmm.
were from the top of the list. We never sat in the ER longer than an hour and a half waiting to get to a room. Most of the time we were back in the room within 20 minutes, 30. But in adult care, it's not the same. So, to go to adult care from children's care, it is a shock to actually go to the ER and have to sit in the ER for 8 hours in pain before you ever get back to the back to even attempt to get medicine to help to control your pain.
So even if I'm walking in and I'm telling you I'm in sickle cell crisis, I'm sure you can visibly see I'm in pain.
But with
And
patients, that's the thing right there, though, Wonder. With our patients, a lot of times they don't visibly look like they're in pain because they have learned to cope with the pain. Their coping mechanisms cover up pain. For
okay.
instance, we had a patient that would be in the hospital and she would do her hair in the hospital and everything else. And they was like, but she doing hair. She can go home. She's coping. You see what I'm saying? They
Mm-hmm.
cope and keep moving with this pain. So a lot of times they don't present in pain. And then sometimes they do present in pain and they still don't get the emergency treatment that they need.
Yeah. Well, you know what? I've had heart issues in the past. I'm still dealing with a couple of things. And somebody told me, I'm laughing about it because now hearing that, I'm going, okay, that makes sense. I shouldn't go to the emergency room looking like this. I'm serious. That's what somebody's like. So you came in looking like this? So you say, what's going on with you? Okay, can't breathe, having chest pains, all this stuff is going on. And they're looking at me like, mm-hmm. So now I get that. Because my thing was, doesn't matter what I look like, I'm telling you what's going on.
we
But
did a
apparently I didn't look sick enough,
Mhm.
you know.
We did a symposium this year back in January
Mm-hmm.
where we did interviews with patients. I recommend anyone that's interested in learning about sickle cell actually go online and find that symposium, because patient stories that are in those symposiums, you would be shocked to. And I said that because I have one of our patients actually was talking about, she was at an event with her husband and she had on a pretty dress, her makeup, her hair was done and everything, and she got in crisis and she went to the ER, and of course, you know, exactly what you just said happened.
Mm-hmm. That is crazy though. And then just until you just said it just now, it didn't click in my head. Okay, so next time I'm just gonna have my hair all over. See, then I'm scared you're gonna think I need to be in a psych ward if I go looking too, whatever. So I don't know. It's that's crazy to me that people make those assumptions. I don't need to look like I'm half dead to be half dead. I mean, I could really be feeling kind of rough. Miss Colin, please share that. Share it in the comment section. That way everybody can see it. That way you can share that link to that video
Okay.
to the symposium. So did we talk about treatments, or what treatments are available, or are there any studies or any kind of support groups or anything like that that a person can be a part of to learn more, or have help in coping with it? Because it just sounds like it's a painful disease, and I'm pretty sure folks need outlets or need somebody to talk to every once in a while.
Right. So any chronic pain disorder, there's an increased risk of mood disorders or depression and anxiety. Sickle cell is not exempt from that. And people that have uncontrolled depression or anxiety with sickle cell disease are going to seek care more often. They're going to stay in the hospital longer. The problem is, as Stella was talking about, the stigmatization among the population. The more patients seek care, the least likely they're believed. And that's how my patients die. Right? Because they come in and they're like, it's a frequent flyer, and then they overlook because they come in for pain all the time. But remember, there's two types of crisis. There's a pain. It's a complicated and uncomplicated. So the uncomplicated crisis is then missed. I mean, the complicated crisis is missed and they have something else going on. And that is not unique to my patients. It's just studies have proven that. Care is getting harder for my patients in the ER because of the opioid epidemic. They have become an unintended victim of the opioid epidemic. And they're overly scrutinized because they do take pain medicine, and I do teach my patients to be knowledgeable. Let's not reinvent the wheel. You go in and say, I take this has worked best, that doesn't work. Unfortunately, in medical education, those are the same things that we teach for drug-seeking behaviors.
Okay.
So a lot of times they're misinterpreted. As for it's very sad. It's very, very sad. And like Stella said, unfortunately, they come in and they don't have any signs of pain. But if you've had your first pain crisis at 9 months and you enter adult care at 18 or 21, your pain appearance looks very different than what is taught in medical education. Now, do our patients come in and tell me they're not hurting? And I know they're hurting, absolutely. But that's like, it's just like your family. It's because I take care of you all the time.
Yeah.
Right. And I'm like, so you're hurting. You're not talking as much. You're not giving me a hard time. And they're like, oh, well, maybe I am. I am hurting a little bit. But they'll do anything a lot of times to avoid the ER.
Wow. See, that's so sad because just even if you didn't have sickle cell, just regular pain. And I'm sitting here thinking about the severity of the pain that folks are in, and not even feeling like you can go and get that kind of help. That's sad to me. That's a failure on the part of our healthcare system to not even. I mean, how do you not? That's got me kind of a little messed up right now because in my head I'm going, everybody takes this oath to do no harm and to make sure that you care for patients as they're coming in, but at the same time, it's like you're just dismissing people and going, oh, well, it's just sickle cell, or oh, they're just looking for drugs. No, they're in pain. And to actually feel like you can't even go get help when you're sick like that, I can see why you have a high rate of depression. That would be hard for anybody to deal with. I mean, if with any kind of pain disorder. that would be hard, hard for somebody to deal with. So that's a failure on our healthcare part that we need to really. I'm sorry. What? Try not to turn my phone on. I think that we really need to look at different ways to make sure that people are getting the care that they need. But that's tough. So
Right. So I've talked about the proactive treatments, the crisis management. There are two curative treatments for sickle cell disease.
Okay.
One being stem cell transplant, and the other one being gene editing. And both of them are currently in studies.
Okay.
Now, the oldest is the stem cell transplant, and I think it either happened in the 1970s or the 1980s. There was a young lady that had leukemia, and she had a stem cell transplant to cure her leukemia. So they went and they took her bone marrow after the stem cell transplant, and they were like, "Oh, wonderful, you don't have leukemia. Oh, wonderful, you also don't have sickle cell disease." So it was an unintentional find. So they were trying to cure her leukemia with a stem cell transplant, but it also cured her sickle cell disease.
Oh, okay.
Right. So that the only problem that we encounter here in Arkansas is it's not considered the standard of care. So Arkansas Medicaid doesn't cover it. But there are studies, and you can go to clinicaltrials.gov to find open studies for those two. Now, there are videos that you'll see on Facebook and on other social media platforms that make it look very glorious and very simple and without complication. That is not true. There is a level of risk associated with stem cell transplantation and gene editing that is often minimized. But it's still a viable option. And I see the future being more of gene editing with sickle cell disease as a curative measure because the side effects are not as great.
Okay. What is gene editing?
Gene editing is they replace I hate to call it the bad cells, but they replace the bad cells in both gene editing and transplant, just different mechanisms, with good cells in hopes that your body only regenerates healthy red blood cells.
Okay.
The biggest thing with that is, although it's a cure, whatever damage the sickle cell has already done to your body is still there.
Okay.
Just moving forward, you shouldn't have any damage. But whatever you already have, go ahead.
So do they do that in kids or is that done in adults or either?
So there's a clinical trial going on in Tennessee at a pediatric hospital, and I believe it does young adults and adults. It might do children as well. But again, I'm an adult provider, so.
Oh, okay.
I'm not as knowledgeable.
Seemed like if you did it in a younger child and they had, I don't know, in my mind, I'm thinking if you did it in a younger child, the cells might have a better chance of replacing, like you said, the bad cells with the good cells, and maybe helping them out a little bit earlier so there's not as much damage done.
Right. Now, there has been some done in children. I just don't know about the open studies in children.
Oh, okay. Okay.
But clinicaltrials.gov, if anyone's searching for those.
And I'm pretty sure that if anybody's watching and they are dealing with this, they're going to want to know as much information. Now, if you don't mind, post that within comments also. And that way folks can see it. Yeah, they can be able to use it. I think one for the video you were talking about, and then post the one for the clinicaltrials.gov.
I'm having trouble finding our video. Will it be possible for me to post in the comments tomorrow?
You can do it later.
Okay. All right.
Just find the video online and then post it under. So yeah, that'd be cool. But I think that'll be a good resource for people that want to know more about sickle cell, or especially if somebody's actually dealing with it or has a relative or a child or something, and that they want to get them in some type of study to, to try to help them get better. So that would be great. I hope that if there's any healthcare providers, especially people that work in the ER watching, that you've heard what these ladies have said about when patients are coming in, and that you start to look at that a little differently. because regardless of what you think might be happening, people still deserve to be cared for and to be treated for what's going on at that moment. Everybody's not hooked on everything. Sometimes people are actually in need and they're hurting and they're desperate. And I hate to eat the even thought of somebody feeling like, they're dealing with that level of pain and they can't even go and seek help for it. That's just crazy to me. So I'm hoping and praying that somebody, that if anybody watches this and um, you work in any kind of healthcare setting, whether it be in the clinic setting or in the hospital or the emergency room, wherever it is, that you always treat, each patient, regardless of what you think may be going on, that you give them the care and the patience that they need. Because I've been in an emergency room before, and I've sat for about, I think the longest I've ever had to sit was about 6 hours, and mine was from having, what did I have then? What is that stuff called? Phlebitis? Was it phlebitis or what was the other thing that hurts like crap? I can't remember what it was called now. That's how bad it hurts. But I don't think that's anywhere near the pain that somebody with sickle cell probably suffers with. So if anybody's watching and you are in the healthcare profession and you are an emergency room person, please, 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 when folks are coming in, just take care of them. Don't worry about all of those stuff. Just take care of them. Just do what you can do to help them get out of that pain, because that just sounds horrible to have to go and be in that level of pain and sit somewhere for 8 hours to wait. That's too much. So, is there anything else you ladies want to add, or anything that you want to talk about as far as, like I said, if there's any help groups or any support groups that you know about, anybody that's meeting? Because you're going to have, like you said, if people are going through that level of pain, they are depressed and they maybe need somebody to talk to. So, you all know about any support groups around town or locally that people can use?
There is not that I know of. I don't know active support groups. I do not.
Mm-hmm.
Just like you were saying that we said on the board of SCORE. SCORE is the new sickle cell organization that's actually in Arkansas that is here to assist patients.
Okay. Okay. Colin, I'm gonna put your comment, the UMS Adult Sickle Cell Program, and the number and stuff in the comments so people can see it. Because only people can see what you posted to me.
Okay.
All right, so I just put that over there so they can see it. You can see it on Facebook and you'll be able to see it on YouTube. That way, if anybody needs to call that number, they can. Anything else that you all want to add? We actually are down to our little time, and I have so appreciated all the information. I hope that anybody watching tonight, if you did not know that much about sickle cell, you all have done a great job of educating us and letting us know that there's just that there one for one thing. As I told you, we didn't know that there was more than one kind. When you hear sickle cell, you just think it's just that one thing. So glad that you all were able to explain to us and kind of expound on it and let us know that there are other things, other kinds or types that people are dealing with, and then giving us some background on how you, as a sickle cell diva, deal with sickle cell at home with you and your kids. So, anything else you all want to add?
I don't have anything else. I don't know of any specific support groups for sickle cell disease, but if there was someone that needed some help, I would consult their insurance company to find local providers, mental health providers.
Mm-hmm.
And UAMS also has AR Connect is available, and it's new since the pandemic, and it offers telemedicine mental health services.
Oh,
You
that's
can
good.
do them from home,
Mm-hmm. Okay.
and I'll
Well,
put that in the comments as well.
all right, good, good, good. That'd be great because again, you'll have somebody watching that either knows somebody or it could be somebody that's watching that's dealing with sickle cell that needs to get that help. So I appreciate you sharing that information. Well, ladies, we got about 5 minutes. Unless you all got some more to add, then we can get out of here early. I don't know about y'all. I still hadn't cooked dinner. I don't cook dinner till 8 o'clock. I don't cook till I get off the show on Tuesday nights, and I'm hungry. I hadn't had anything since lunch. But thank you all so much for. Oh, let me post the AR connecting first. Thank you all so much for coming on tonight and educating us on sickle cell and giving us some good background information. giving us some resources we can share and use, and just kind of just letting us know that there's more. Again, I go back to it, letting us know that there's more than one kind, and then giving us insight into how people and what things that sickle cell patients deal with. Miss Stella, God bless you and your babies. I hope that y'all continue to stay healthy and everything works out for you. Miss Collins, thank you so much. I know you had a little bit of trouble getting on, but I'm glad you were finally able to get in. But thank you all so much for taking some time this evening to make us aware of this because, again, one of the things that we want to do in the Ladies Lounge on the show is to make sure that we're educating, empowering, and encouraging women to live their best lives. And this is one of those things that helps us to educate each other and live best lives so that we know what's going on. We have a good grasp of the information, and then we have some resources we can refer back to. Ms. Colin, I'll be looking forward to you posting that video. So if anybody wants that information, they'll be able to go in and click a link under this video later on in the week and get that information. And if we can contact you at that adult sickle cell program is where both of you are, right?
Yes.
Okay, so good. They'll be able to get in contact with you if they need some help. And again, thank you, ladies. If there is nothing else, and y'all have a great evening. Stick around for just a second when we sign off. I want to make sure I get a little picture of us real quick. But thank you again for those who were able to tune in this evening and get a glimpse of the show and be able to get some information on sickle anemia awareness. Appreciate you all tuning in as always every Tuesday night right here in the Ladies Lounge, Central Standard Time. We're on. Next week we'll be back. Don't remember what next week is. I'll let y'all know when next week comes. So I do know this much. Y'all know I never get the day right. I know the next Tuesday is June the 29th. How about that? Because I never get the dates right. I forget every week. And then all I do is add 7. And I'll be like, it's something else. I'll think something really weird. But either way, we'll be back on June the 29th, next Tuesday at 7 o'clock again for another episode of the Ladies Lounge. Again, ladies, thank you, Miss Stella. Thank you, Colin. I appreciate you all. I think we're supposed to have y'all back later on in the year to discuss something else because I think Sickle Cell Awareness Month is in September, right?
Yes.
Okay. So we'll probably have you back in then to give kind of a refresher and just, let us know if there's any new developments or if you all know of some new treatments or anything that's going on. UMS might have something going on different by then. And you all are surely welcome to come back and not just on sickle cell, but if there are other health issues that you all want to come in and talk about, that is totally fine with me. And I did not mention, but both of you are members of the Black Nurses Association of Arkansas, right?
I am, yes, ma'am.
Okay. I knew somebody was. I wasn't sure if both of y'all were or not, but okay. Well, thank you so much because I think I contacted them first and they got you to me. So yeah. Thank you so much. I appreciate that.
All right.
And go ahead.
Thank you for having us.
All right. Anytime. Miss Colin? She's still there? You there?
I'm still here. I'm searching for this video. Thank you so much for having us.
All right. Thank y'all. All right. Well, people, we will see y'all again next week at 7 o'clock in the same place for another episode of the Ladies Lounge from Under Low. I'm your host, and I'll see you next Tuesday. Good night.
Good night.
Good night.